Erlanger's new Heart and Lung Institute offers many services, one of which is helping patients understand, manage, and prevent cardiovascular ramifications of chemotherapy treatments. So joining us to tell us a little bit more is Dr. Patrick Stevens. Thanks for joining us.
Oh, thanks for having me.
Now, you are a specialist with the Institute, so tell me a little bit more about your role.
Right, so I'm a general cardiologist who also sees oncology patients, and it's part of kind of the team approach that we're focusing on at Erlanger, which is bringing specialists from a lot of different areas together to treat the whole patient. And so I work with oncologists, radiation oncologists, nurses, nutritionists, and we try to provide the best care to oncology patients. What we found out in the last 10 years or so is now that we're treating these patients so well and they're living longer, that some of the medicines we give them can cause heart side effects down the road, or even as they get the medications. And so I work with those providers to monitor patients, to try and treat them up front to prevent those events from happening. And so, you know, as an example, breast cancer patients are people who I work with quite frequently because some of those drugs can cause reduction in heart function, so we call that heart failure. And then also they can get radiation to the left side of the chest, which can have the heart in the field, and then down the road that can lead to issues with heart artery narrowing or heart dysfunction. And so
it's so important to stay up front and ahead of these issues because we have to treat the original cause, right? We can't just sit back and let it happen. So it's so important to understand this information and be proactive about it.
Yeah, and I think a lot of this comes down to prevention, which is what we really focus on nowadays in cardiology. It's great to prevent a heart attack. It's better to prevent a heart attack than to treat a heart attack that's happening. And so looking at things like making sure patients are on cholesterol medicines at the right time, which maybe doesn't seem like a big deal, but actually is, because it can prevent heart attacks 10, 15 years from now. Wow. And so talking to patients about making sure that, you know, diet, exercise, all those important things that can help prevent things down the road. And I think that's what we're really pushing for, is prevention as well as treatment.
Knowledge is key, right?
That's right.
Okay, so talking a little bit more about the new Heart and Lung Institute, just opened this past Thursday, but there's been some anticipation and it's been a long process, right?
Yeah, this has been in the works for several years now. I've had a lot of people working behind the scenes on this for quite a while, and it was a really big accomplishment for Erlanger and for the city to have this type of facility open. It really allows us to provide cutting-edge care to patients. You know, it's a beautiful space. We have a lot of operating rooms and cath labs side by side. And again, this kind of goes towards that team approach where you have surgeons and cardiologists working in pretty close proximity together. And if you have a question, there's somebody right there who can come help. And that's what we're really pushing for, is, you know, providing innovative care and really working as a team.
Right. And having a facility like this here in Chattanooga and having the team approach that Erlanger has, I don't think people understand how important it is to a patient and a family unless they're personally affected by it. But the opportunity to be able to stay here and to stay around your family where your family doesn't have to travel or the patient doesn't have to travel, that means a complete difference and actually can sometimes have an effect on the outcome.
Yeah, I agree. You know, I think, you know, previously we would potentially have to send some of these patients to other places, you know, Vanderbilt or Emory, but now we can keep them here because we have this really cutting edge technology and really beautiful facilities where we can really take care of these patients. So a lot of things now are able to be done here, be done in potentially a lot of settings minimally invasive, so there's faster recovery. One of the things we're really working with right now is doing minimally invasive bypass surgeries. So our cardiothoracic director, Larry Shears, has been working on that, so not having to cut open the chest, but doing surgery through a small incision and decreasing the amount of time that it takes to recover.
What a difference that will make. Now, and Dr. Stevens, like we talked about, you're fairly new with Erlanger, but we're excited to have you here. So what do you see as the future for the Institute and Erlanger as a whole?
Well, I think, you know, trying to first establish ourselves as a regional powerhouse, which I think we're really well on our way to doing right now. We've got, you know, again, state-of-the-art facilities and a lot of really great people. But I think, you know, trying to be recognized on more of a national level, and part of that is, you know, doing research and being involved in research, which is something we're starting to really spearhead now, doing clinical trials, and then just bringing in the best physicians we can and pushing that team approach. And I think that'll really get us recognized on more of a national level. And I think that's why we're all here, is to provide the best care to patients not just in Chattanooga, but everywhere in the state.
Anyone who needs it, right?
That's right.
Well, perfect. Well, Dr. Stevens, thanks so much for joining us and telling us a little bit more about the brand new Heart and Lung Institute at Erlanger. I'm sure if you just want to see it, you can stop by, but we hope you're not a patient there. But if you are, you're in good hands, obviously. All right, thanks so much for joining us. For more information on Erlanger and the Heart and Lung Institute, you can give them a call. The phone number's there on your screen, and they are, of course, online, erlanger.com. We'll be right back.